Welcome to our podcast series on everyday health vocabulary.
Welcome, listeners, to our detailed exploration of common medical terms and practical advice.
Today, we will cover the words bruise, hundreds, first aid, wound, and bathe. Let's begin with bruise. It is a mark on the skin where blood vessels have been damaged by impact.
A bruise can appear blue, purple, or brown and usually fades over time.
For example, a child may get a bruise on the knee after falling off a bike.
Ice and rest often help a bruise heal more quickly.
Next, the phrase hundreds of something means a large amount or number.
You might say hundreds of people attended a health fair last weekend.
The term hundreds emphasizes that the quantity is significant.
It's often used informally to express magnitude, such as hundreds of examples.
Now, the concept of first aid. It refers to simple medical treatment given immediately after an injury.
Proper first aid can prevent further harm before professional help arrives.
For instance, applying pressure to stop bleeding is a key first aid step.
Knowing basic first aid can save lives in emergencies.
Moving on to wound. This is an injury involving a break in the skin or underlying tissues.
A wound can be from a cut, scrape, or puncture.
Cleaning a wound promptly reduces the risk of infection.
Medical attention is advised if the wound is deep or bleeding heavily.
Finally, bathe means to wash part or all of the body, often for medical reasons.
You may need to bathe a wound with antiseptic solution.
Seniors or patients might require assistance to bathe safely after surgery.
A warm bath can soothe muscles and promote relaxation.
In our podcast today, we will explore each word with detailed examples and real-life scenarios.
Our goal is to help new viewers fully understand these terms and use them confidently.
Consider a young athlete who gets a bruise after colliding with another player on the field.
The coach applies ice to the bruise immediately to reduce swelling.
Over the next few days, the bruise changes from purple to yellow.
Proper rest and gentle massage help the bruise fade faster.
Imagine attending an event where hundreds of volunteers gather to teach first aid.
Each station covers different topics, including caring for a wound.
Participants practice dressing a simulated wound using sterile gauze.
Trainers emphasize the importance of performing first aid correctly.
Picture a scenario in which someone cuts their hand while chopping vegetables, a common wound.
The person rinses the wound under running water to remove debris.
Then they apply an antiseptic and cover the wound with a clean bandage.
This basic first aid step helps prevent infection.
Now, an elderly patient who cannot easily bathe themselves after hip surgery.
A caregiver gently helps the patient bathe while maintaining dignity.
Special equipment like a shower chair can make it safer to bathe.
Regular bathing supports hygiene and comfort during recovery.
Hundreds of stories have shown how effective first aid saves lives in extreme situations.
In one account, a hiker applied first aid to a deep wound before rescue arrived.
The prompt care stabilized the injury and prevented severe blood loss.
Later, medical staff praised the hiker's knowledge of first aid.
In another tale, a child's fall resulted in a large bruise on the forehead.
The parents explained that a cold compress reduces the pain of a bruise.
They also used a topical gel to help the bruise heal.
The child recovered quickly thanks to swift and gentle care.
Workshops often demonstrate how to manage hundreds of injury scenarios.
Volunteers role-play treating a wound in a simulated disaster drill.
They practice stitching techniques under professional supervision.
This hands-on approach builds confidence in administering first aid.
Let's hear real voices. One listener described needing to bathe a burn injury.
They soaked a gauze pad in cool water and gently bathed the area to relieve pain.
Another listener recounted applying first aid to a wound at a construction site.
Their quick action prevented an infection and allowed the worker to return home safely.
In our advanced segment, we address how to treat complex wound types.
Puncture wounds require careful cleaning because debris can be deep inside.
Animal bites often cause irregular wounds that need thorough irrigation.
The risk of infection is higher, so professional first aid and medical follow-up are crucial.
When you bathe a surgical incision, follow your doctor's instructions exactly.
Use only recommended solutions to bathe and avoid harsh soaps.
Repeated gentle bathing helps prevent scab buildup and promotes healing.
Observe for signs of infection, such as redness or swelling around the wound.
Frameworks for teaching first aid often involve hundreds of visual aids.
Trainees may study hundreds of illustrated steps for different emergency scenarios.
This repetition ensures that volunteers retain vital information under stress.
The ability to recall hundreds of details can be life-saving.
Let's role play. You find someone with a deep wound in the park.
You call for help and then start basic first aid by applying pressure.
While waiting for professionals, you keep the wound clean and covered.
After help arrives, you report the steps taken to administer first aid.
A commuter reported stepping on broken glass and receiving a foot wound.
They cleaned the wound, applied an antiseptic, and put on a waterproof bandage to bathe it when showering.
This prevented water from irritating the wound and reduced infection risk.
Their careful first aid routine ensured a smooth recovery.
The usage of the word bruise is not limited to skin.
In literature, emotions can cause a bruise to the spirit, metaphorically.
A character's heartbreak is described as a deep bruise on their soul.
This figurative use highlights the word's versatility.
During a marathon, a runner tripped and suffered hundreds of small scrapes and one serious bruise.
They continued to the aid station, where medics administered first aid.
They cleaned each scrape as if treating hundreds of tiny wounds.
This comprehensive care helped the runner finish the race.
In hospitals, nurses bathe patients who cannot move on their own.
This practice is called a bed bath and is essential for hygiene.
They use gentle motions to bathe each part of the body safely.
Bed baths also provide an opportunity for nurses to monitor wound healing.